Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you so much for joining us today. We all want to feel safe. We all feel that our healthcare professionals and providers are doing the utmost to keep us safe and to also keep themselves safe as they go about their daily business curing disease and research and whatnot. Our guest in studio today is Frank Mazza. He is here as Chief Medical Officer for Quantros, here to talk about the safety and reporting industries as it relates to healthcare. How are you doing today, Dr. Mazza?
Neal, I'm doing great. How are you?
Doing well. Quantros. Talk about Quantros. Tell us what Quantros is involved in and how you became involved with Quantros.
Well, Quantros is a company that's been around for about 20 years. Mm-hmm. Our purpose is that we make software that allows companies to function at the highest level of quality that they possibly can, and also software that prevents errors that can lead to problems with patient safety. Okay. We were one of the first really in the world at doing this. We're quite well known in the industry, and today we're in well over 1,000 healthcare establishments that include hospitals, retail pharmacies, and other organizations that are like that.
Now, this software, how long has it been in development, this particular, this latest update?
Well, we continually update our solutions, as you might imagine. Mm-hmm. We are particularly proud of the fact that our event reporting software has something that we've been rolling out to all of our institutions over the past year or so, and it's been very, very well received. Mm-hmm. The whole notion of event reporting is that if you want to be an organization that offers the safest care you possibly can, you have to know where your vulnerabilities are. So you have to know where you make errors. And you have to rely on frontline people who have experienced those errors to enter that information into a system so that you can aggregate that data and learn exactly where those vulnerabilities are and how you can fix them. So we're particularly proud because this solution that we have is one that allows frontline personnel to enter this information in as little as 2 to 3 minutes. And that's very, very important because this is an era when healthcare personnel are working very, very hard, much harder than they ever have before, and patients are sicker than they have been before. So it really takes a significant amount of time away from patient care that they need to do if their event reporting system duties take more than a few minutes.
Now, you mentioned retail pharmacies, hospitals, healthcare centers, as it were. What about emergency care? Do you have software that is easily transitional between the two, or do you specialize when it comes to emergency care, elder care, regular hospital care, and so on?
To some extent, our software could be used in really just about any healthcare setting, and it is used in any healthcare setting. That being said, I think that one of the things that we're having to think about is that as the industry is moving away from sort of an inpatient focus to more outpatient type care delivery, how do we evolve our solutions so that they can allow providers who are in those settings to get the most out of them?
Are you involved in telemedicine to any extent as it relates to safety and quality?
Well, we would not be, in the sense that we don't deliver the care. Telemedicine is a unique and exciting and evolving type of healthcare delivery for certain settings. And certainly we would be able to capture errors that occur in our event reporting system that transpire as a result of things that go wrong when you're trying to deliver healthcare through a telemedicine forum. But really, since we aren't the care delivery people, we're just assisting those folks in doing the best job they can possibly do.
Now, does your software easily conform with, say, Sarbanes-Oxley as that relates to any type of organization, as far as archiving information and evidence and data?
Oh, I mean, absolutely. Quite frankly, I'm not so familiar with Sarbanes-Oxley outside of the financial industry to be able to say that it's relevant here, but very clearly, when you're trying to understand where you're having problems in patient safety, you've got to be able to aggregate data in a manner that it tells you something about, from the standpoint of severity and also frequency, where you're having most of your problems, because that's where you really want to focus all of your efforts.
Where can we get more information about Quantros? What is your web presence as far as a website?
Well, it's www.quantros.com, or any individual who is interested could also dial 1-877-Quantros. Quantros is spelled Q-U-A-N like in Norman, T like in Thomas, R-O-S like in Stephen.
What are some of the myths that you might want to dispel when it comes to the incident reporting industry, and how Quantros is making strides to make that industry better?
Well, much of what we know about incident reporting comes from other industries, and in terms of the success of learning about errors and safety science, and much of even those other industries, much of that information actually comes from the airline industry. And what we know from the success of the airline industry is, first, the reporting system has to be very simple and easy. And as I said, our most recent product is, I think, the fastest event reporting product in the industry. It's got to be confidential. People are willing to report the errors that they made or that they witnessed, but at the same time, they have a fear of doing so to individuals who could take recourse against them. So our product is similar to what the airline industry has done. It's confidential. The information has to be aggregatable, and we use a taxonomy that allows these errors to be collectively analyzed in a way where, again, action can be taken by the affected organization. And there's a number of other things that are characteristics of very high quality event reporting systems, and based upon the evidence and the science, we have worked hard to incorporate all of those into our solutions.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio this afternoon talking with Dr. Frank Mazza, Chief Medical Officer for Quantros Corporation, about the incident reporting industry and how Quantros can provide healthcare organizations with data feedback about their events that is actionable, measurable, and most of all, meaningful. It's been great having you here with us today, Doctor.
Same here, Neal. Thank you for allowing us to be present and to speak with folks on your program.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.